Hello, my name is Elise Dressel. I am the lead disease surveillance practitioner at Kane County Health Department. In this presentation, we'll be covering measles contact tracing, including objectives and steps. There are 8 steps to the contact tracing interview, and today we will cover each step in detail and also provide some examples. After today's presentation, you should be able to understand and describe the 8 steps of a contact tracing interview, the purpose of each step, how to determine a contact's immunization status and their symptom monitoring period. And lastly, we will go over what to do if you cannot determine a contact's immunization status during the first call. First, let's go over what the introduction should look like. At this stage in the call, the goal is to introduce yourself and verify that the contact was exposed to measles. When you first start the call, you'll want to ensure that you are speaking with the contact by asking if you're speaking to so-and-so or asking to speak with so-and-so. If you're not speaking with the contact and somebody else has picked up the phone, you'll want to ask to speak with the contact. However, if they're unavailable, let the individual on the phone know that you will be calling back at a later date. Now, if you are speaking with a contact, great. The next step will be to ensure that the contact was in fact at the site where the measles exposure occurred on the date that it occurred. Once you've verified this information, it's important to ask about others who were exposed as well. It might be helpful to ask if they were with anyone else at the event to get this information. If they know of others that were at the event where the measles exposure occurred, it's important to get those individuals' information, including names, addresses, and phone numbers. Next, before moving forward to the next step of the interview, you'll want to let the contact know that they were exposed to measles, but you'll be asking some questions about them, their symptoms, and their vaccination status, and that most importantly, everything the two of you talk about is completely confidential and protected by HIPAA laws. After the introduction, you'll want to gather some demographic information. This is a pretty straightforward step and involves asking them for their home address, their email address, primary and any secondary phone numbers, their preferred language, and either where they work or attend school, or specifically, if they work in healthcare. After collecting demographic information, the next step is to assess the contact's personal risk of illness and complications associated with measles. You'll want to ask if they have any immunocompromising conditions, take medications that weaken their immune system, or if they have any contact with individuals who are immunocompromised. It's often helpful to provide some examples of when someone might be considered immunocompromised, such as someone who has cancer, HIV, or diabetes. There are many conditions that establish someone as immunocompromised, and it's important that you familiarize yourself with these conditions. After, you'll also want to ask if the individual is pregnant or has contact with pregnant persons, and if they have contact with infants under a year old. All of these factors can increase a contact's risk of illness and complications and/or increase risk for others who interact regularly with the contact. The next step in the interview involves gathering information related to measles symptoms. There are several main symptoms associated with measles that we want to directly ask about. These include fever, cough, runny nose, red or sore eyes, and a rash. It's important to get as much detail as possible about any symptoms they are experiencing. For instance, you'll want to know if they have a thermometer to take their temperature. If they do, and report that they have a fever, you'll want to ask questions like when the fever started and what their temperature is. If they report other symptoms, you'll want to ask when those started as well, and may have additional questions specific to each symptom. For example, if the contact reports that they have a rash, you'll want to collect information on where the rash first appeared, what it looks like, where it is now, and if it has spread from where it started. Additionally, other important questions to ask when discussing symptoms include if they're having symptoms other than those mentioned, if they've been sick recently with other illnesses, if they've been taking any over-the-counter or prescribed medications for their symptoms, and if they have allergies or other health conditions that may be attributing to their symptoms. It's important to be as detailed as possible when gathering symptom information, as it can tell a lot about a contact's current status and whether or not they may become a case. Step 5 of the contact tracing interview involves collecting information regarding the contact's vaccination status, their date of birth, and relevant laboratory records to determine if they are immune or not immune to measles. Determining immunity will assist you in figuring out what steps the contact will need to take in the coming weeks to keep themselves and the community safe. These steps may include symptom monitoring, receiving post-exposure prophylaxis, or even quarantine or isolation. So it's important that you really understand this step and how to initiate this process. The measles contact management algorithm breaks down the method to determining immunization status, recommendations, and requirements, and can be found at the end of this presentation. However, we will break the algorithm down for you to understand over the next several slides. Certain criteria provide what we call evidence of immunity, meaning we can presume that the contact is immune if they're able to provide appropriate evidence. The first step is to discuss vaccination and seek written documentation of adequate MMR vaccination. If an individual is 4 years old or older and/or high risk, 2 doses of the MMR vaccine is considered evidence of presumed immunity. If an individual is younger than 4 or an older individual who is not high risk, 1 dose of the MMR vaccine is appropriate evidence. As a reminder, a high-risk setting includes higher educational institutions, healthcare facilities, or international countries. But a person may also be considered high risk if they have certain medical conditions such as HIV or are household members or close contacts of individuals with immunocompromising conditions. If an individual is unvaccinated or has an unknown vaccination status, the next item to look at when determining if they have evidence of immunity is to look at available laboratory records. A contact can still be presumed immune if they have laboratory records that verify that they are immune to measles or that they had a previous measles infection. If neither vaccination nor lab records that provide evidence of presumed immunity are available, it's time to look at their date of birth. Individuals who were born before January 1st, 1957, or in other words, born on or before December 30th of 1956, are considered immune to measles. However, importantly, healthcare workers must have 2 doses of MMR, even if born before 1957. When interviewing a contact, if they are allegedly vaccinated but cannot provide any of the previously mentioned documents to serve as evidence of immunity, their status might be able to be verified by accessing Illinois school vaccine records or through serum immunoglobulin titer results, which require a blood draw. Kane County Health Department will provide a secure way for contacts and cases to send their vaccination and laboratory records. At this time, call the KCHD CD program phone line at 630-232-5861 and make arrangements for sending documentation on immunization status securely. It is up to the contact or case's discretion how they choose to send their information if more than one option is provided. Now let's discuss the step of the phone call focused on symptom monitoring requirements. In general, a contact exposed to measles will want to monitor for symptoms for 3 weeks or 21 days after they were exposed. However, there are differences depending on a contact's immunization status. For contacts who are able to provide evidence of immunity, they are required to self-monitor for symptoms of measles for 21 days after their exposure date. These individuals do not need to stay away from others in public spaces unless they develop symptoms. On the other hand, contacts who are not immune to measles or cannot provide evidence of immunity must quarantine from days 7 to 21 after their exposure date. For healthcare workers, this would instead be from days 5 to 21. Quarantine entails staying away from others in public spaces while also monitoring for the onset of symptoms. For a contact in quarantine, Kane County Health Department will actively monitor for symptoms rather than have the contact self-monitor. And if a contact in quarantine does develop symptoms, they will need to isolate. Isolation is used for cases who have suspected, probable, or confirmed measles, which includes contacts whose status was changed to case after they developed symptoms. In this case, isolation must start immediately and last until 4 days after the onset of the rash. Similar to with quarantine, Kane County Health Department will actively monitor cases with measles and check in daily to see how they are feeling. We just covered a lot of information on symptom monitoring, so let's briefly summarize the key points. Symptom monitoring is only performed for contacts who have been exposed to measles and may or may not become ill. Immune contacts can monitor themselves for symptoms, whereas non-immune contacts need to be actively monitored by Kane County Health Department. Cases, however, do not need to monitor for symptoms, since they already know that they have measles. Instead, they need to isolate to limit the chance of disease transmission to others. But Kane County Health Department will still actively follow up with cases about their symptoms and measles infection. The next few slides provide flowcharts on what we've discussed in terms of evidence of immunity, symptom monitoring, and quarantine and isolation requirements. These charts can be used to simplify the process of determining immunization status. So let's walk through this first chart together. The first piece to consider when determining immunization status is done by looking at vaccination records. As we've discussed, if the contact is vaccinated and able to provide evidence of immunity, they can self-monitor for symptoms for 21 days after the date of their exposure to measles. 2 doses are sufficient evidence of immunity for individuals 4 years and older and for individuals in high-risk transmission settings or at high risk. If the contact has only 1 dose and is older than 4 years old, or at high risk or in a high-risk setting for transmission, such as a healthcare worker, it is recommended they receive a second dose no sooner than 28 days after the first dose. Individuals with only 1 dose can self-monitor for symptoms for 21 days after the exposure date, except for school-age children who will be actively monitored by Kane County. A contact who states they are vaccinated but do not have medical record of their vaccination will need to provide Illinois school vaccination records to determine immunity. If they cannot provide this information or it cannot be retrieved from the school, they must get measles titers to determine immunity. If they get a titer, which is done through a blood test, they need to quarantine from day 7 after the exposure date until the results are available and immunity status is verified by the health department. It is also recommended that they receive a dose of the MMR vaccine as post-exposure prophylaxis. And for healthcare workers, this quarantine would occur starting at day 5. If the results of the titer are positive, they would be treated the same as a contact with evidence of immunity and can self-monitor for 21 days after the date of exposure. If the titer is negative, the contact is treated like an unvaccinated contact, and they would need to quarantine from days 7 to 21 or days 5 to 21 for healthcare workers after the date of exposure while Kane County actively monitors for symptoms. Now, what if you have determined that the contact is not vaccinated or cannot provide evidence of vaccination, but you know that they were born before January 1st, 1957? In this case, they need to self-monitor for symptoms for 21 days after the date of exposure, just like a vaccinated contact. This is because individuals who are born before 1957 are considered immune as they likely had measles infection at some point in their life, which provides lifelong immunity. If the contact is a healthcare worker and therefore working in a high-risk setting for transmission, it is recommended that they have 2 doses of the MMR vaccine, even if born before 1957. But the state of Illinois does not require quarantine if they don't have complete vaccination. For contacts born on or after January 1st, 1957, we follow similar guidance as described in the previous slide for individuals without otherwise immunity. In the event they are a healthcare worker and do not have other evidence of immunity, they must quarantine from days 5 to 21 after exposure, even if they receive post-exposure prophylaxis. If a contact is unable to provide evidence of immunity by any of the methods that we have gone over, it is recommended that they receive post-exposure prophylaxis. Most of the time, this means receiving the MMR vaccine within 72 hours of exposure. However, for individuals in specific groups, such as those who are pregnant, immunocompromised, or individuals aged 6 months or younger, they may instead be recommended to receive immune globulin within 6 days of exposure. The last handful of slides have covered a lot of information on how to determine a contact's immunization status and what is required of the contact in terms of symptom monitoring or quarantine based on their status. This slide breaks down that same information but is organized by evidence of immunity and whether or not they receive post-exposure prophylaxis. So let's break that information down. As we've discussed, a non-healthcare worker contact that can provide evidence of immunity often only needs to self-monitor for symptoms for 21 days after the date of exposure. This includes contacts who are vaccinated with the appropriate number of doses for their age and risk, those who can provide laboratory evidence of a previous measles infection or of immunity via titer results, or those who are born before 1957 and are not healthcare workers. School-age children with only 1 dose will be actively monitored by Kane County. If an individual has no evidence of immunity and they do not receive any form of post-exposure prophylaxis, such as the MMR vaccine or immune globulin, They must quarantine, and Kane County will actively monitor for symptoms. As a reminder, quarantine occurs from days 7 to 21 after the exposure date, except for healthcare workers, who must quarantine from days 5 to 21. If the contact is given a dose of the MMR vaccine within 72 hours of exposure as post-exposure prophylaxis, they will need to self-monitor for symptoms for 21 days after the exposure date, unless King County decides to monitor them. Also, from days 7 to 21 after the exposure, they must avoid high-risk groups and public settings if possible. For individuals who receive immune globulin, they must quarantine for 28 days after exposure due to their high risk of infection and complications, and will be actively monitored by Kane County. For contacts who do not have evidence of immunity but get their blood drawn for a serum immunoglobulin titer, they need to quarantine until the results are available, at which point the requirements will be reevaluated based on the titer results. Additionally, it's recommended they receive a dose of the MMR vaccine as post-exposure prophylaxis. Even if the titer results show that they are immune, getting an additional dose of the vaccine will not be harmful in any way. And lastly, any suspected, probable, or confirmed cases, including contacts who have become symptomatic and have their status changed to case, must isolate for at least 4 days after the start of the rash. This slide is very similar to the last, but covers requirements for healthcare workers specifically. Notable differences include quarantine starting at day 5 rather than day 7, and the need for quarantine and active symptom monitoring among MMR recipients. Public callers are members of the public who responded to a public health announcement of a measles exposure and call the health department. An example of a public caller is someone who calls the health department after they were at the location of an identified measles case and therefore believe they may have been exposed. Guidance is a bit different for public callers when they are either unvaccinated or their vaccination status is unknown. Under both circumstances, it is recommended that the public caller receive a dose of MMR as post-exposure prophylaxis and that they self-monitor for symptoms for 21 days after the date of exposure. For those with unknown vaccination status, it is also recommended that they get their blood drawn for a titer test to determine immunity. Notice, the difference between close contacts and public callers is that public callers are not required to quarantine, and King County will not actively monitor public callers under any capacity. However, much like contacts, if public callers become symptomatic, they should follow isolation guidance for cases. In summary, regarding requirements of a close contact or public caller, please refer to the measles contact tracing algorithm, which provides clear guidance organized by immunization status. Let's apply what we've learned about symptom monitoring requirements with a few examples. First, let's go over an example of a contact that requires self-monitoring for symptoms. In this example, the contact's name is Leo. Leo was exposed to measles on March 7th. He is fully vaccinated and able to provide evidence of immunity. Because of his immunization status, based on what we know for immune contacts, Leo needs to self-monitor for symptoms through day 21 after the date of his exposure to measles, which would be through March 28th. Since Leo is immunized, Kane County Health Department does not need to check in daily with Leo. Additionally, he does not need to quarantine. However, if he does develop symptoms during his symptom monitoring period, his status is changed to case, and he will need to isolate for at least 4 days after the onset of the rash. Mary was exposed on the same date as Leo, but is not immune to measles. She did not receive the MMR vaccine or immune globulin as post-exposure prophylaxis. So, Mary must quarantine from days 7 through 21 after the exposure date, which would be from March 14th to March 28th in her case. As a reminder, if she were a healthcare worker, her quarantine would instead be from days 5 to 21. Kane County Health Department will check in daily with Mary to evaluate for symptoms through day 21, which, like Leo, would be March 28th. For our last example, let's look at what isolation would look like for a case. June has measles and develops a rash on March 7th. We consider March 7th to be day 0, and June needs to isolate for at least 4 days after the rash began. So, with March 7th being day 0, we count 4 days after that. Day 4 would then be March 11th, and if she is cleared to return to normal participation, she can do so as soon as March 12th, which will be considered day 5. Kane County will check in with June daily, much like we would for someone who is in quarantine, such as Mary. An important reminder and something to remember, If a contact is not immune or cannot provide sufficient evidence of immunity, Kane County Health Department needs to actively monitor the contact for the full symptom monitor period, which lasts for 21 days after the exposure date. However, if the contact is able to provide evidence of immunity at any point during that period, they no longer need to be actively monitored by the health department and can instead self-monitor for symptoms. The one caveat to this is school-age children with one dose, as King County Health Department will continue to actively monitor those individuals, even though they're technically considered presumed immune. The last portion of the contact tracing interview phone call involves wrapping up the discussion you've had with the contact. This includes repeating the estimated date for which their isolation, quarantine, and/or symptom monitoring period will end. The health department can provide a release letter to the contact or case in the instance that the school or workplace requires one to verify the end of isolation. Make sure to collect information of whom the letter needs to be sent to, whether it be to the case or contact or their employer. Another option is for contacts and cases to call the main line at 630-208-3801 to request a letter. Additionally, if Kane County Health Department will be checking in daily, for instance, if they are required to quarantine or isolate, ask if they prefer email, text, or calls, and what time of day they would like to be contacted if they prefer to receive calls. If the contact was not able to provide evidence of immunity during the first call, for instance, if they are allegedly vaccinated but need to reach out to their school to get their vaccination records, or if they will be needing some sort of update regarding the requirements, let them know that you will be calling them a second time within 24 to 48 hours to retrieve that information. Before wrapping up, it's important to ask if they have any questions that you can answer before the end of the call. If not, thank them for their time and provide them with the appropriate contact information in case they need to reach out. And lastly, let them know that if they develop symptoms at any point during their symptom monitoring period, they need to stay home and call their healthcare provider for their provider to make arrangements before going to the healthcare facility to receive care. On the previous slide, we briefly discussed circumstances under which a contact will need a second call. This is done when they cannot provide evidence of immunity during the first call. They will need to be contacted approximately 24 to 48 hours after the first call to retrieve this evidence. During the second call, if the contact is able to provide evidence of immunity, their quarantine will end and their requirements change to self-monitoring for symptoms through the remainder of the symptom monitor period. However, if they still cannot provide evidence of immunity during the second call, they will need to remain in quarantine through the remainder of the symptom monitor period, and Kane County will continue to monitor daily. Sometimes you will attempt to reach a contact, but they do not answer the phone. In this instance, it's best practice to leave a voicemail stating who you are and where you're calling from, and ask that they give you a call back at their earliest convenience. It is important not to leave any detailed information about the contact, their exposure, or illness. If someone else other than the contact answers the phone when you call, you will want to speak with the contact, but if they are not available, let the person on the phone know that you will be calling back later. Do not leave any detailed information about the contact, their exposure, or illness. This slide provides an example of a voicemail to leave when the contact does not answer the phone. Please notice the voicemail states with who you are and where you're calling from, but does not leave any detailed information about the contact, their exposure, or possible illness. This slide provides important phone numbers that may be beneficial for contacts or cases if they need to reach out to Kane County or contact a medical provider in the area. And lastly, it is recommended that you reference this measles contact management algorithm for detailed guidance on requirements for contacts based on their immunization status. This table does occasionally get updated, and this version is from November 2024. And on this slide is the footnotes for the measles contact management algorithm. Ensure you review this thoroughly. Thank you and have a great day.